My biggest professional challenge this time during this pandemic was the fact that while everybody's attention is focused on COVID 19, our patients would not get proper attention for their existing chronic medical problems. Being a medical doctor, that is my main concern, that their chronic problems are well taken care of. That would be their diabetes, high blood pressure, anxiety, or depression. Um, we realized in the early phases of this pandemic, when there were cases in Seattle area, there were a lot of 911 calls for fear of going to the hospital. The people were staying indoors, and as a result of that, their chronic problems had worsened, and they were at-home deaths. They were cardiac arrests at home because people would not go to the hospital for fear of interacting with the medical professional or going into a medical environment. Also in hotspots like New York, New Jersey, Boston area, there were at least 4 times higher at-home deaths reported. And all over the world, in USA, UK, China, Spain, they found that in the midst of the pandemic, when people were not going to the hospital, they presented to the hospitals at a very late stage, be it their appendicitis or be it their gallbladder disease or be it a TIA or a stroke. And they found a rapid decline in the actual number of heart attacks. That is simply because people were having cardiac arrest and dying at home. So we wanted to reach out to our patients to tell them that we are there for them and we can guide them as to when to stay home and when to seek medical attention. And what we did at that point was embrace telemedicine early on, so that we were able to reach out to our patients through the audio or or video calls. That way, we were in touch with them, managing their diabetes, hypertension, advising them about chest pain, also encouraging them to go to the hospital if the symptoms were serious. So there was a time when we would suspect, say, an appendicitis or a gallbladder attack. That is not a time to be afraid to go to the hospital. We reassured our patients that hospitals are still the safest places, and when there is an emergency, they should not defer their chronic care or even an acute emergency for fear of contracting the COVID-19.